Robotic surgery, once considered a novelty 25 years ago, has become a hit with surgeons around the world, including here at home. At Salem Hospital May 30th, the latest in robotic surgery systems pioneered by Intuitive Surgical were unveiled when its Thoracic Oncology Mobile Experience, or TOME truck, arrived at the hospital. The public as well as surgeons and their teams were invited to try out the newest Da Vinci 5 robotic surgery system and the ion bronchoscopy system, which Intuitive says is a game changer in early cancer detection. The mobile exhibit itself is a game changer, a roving laboratory on an 18-wheel, 80,000-pound truck traveling around the country giving surgeons hands-on training and experience testing new features and functions. People from the community can also experience the technology surgeons use. In place of tiny surgical tools, the mobile lab system uses a tiny set of objects so people sitting at a nearby console can move them remotely, putting rings on them or setting them on a tiny shelf.
What I've set up is a couple of different models for public, referring physicians, as well as community members to come in and really get a sense of what the technology is and really the benefit that it can potentially provide patients. One of the big key, things that I'd like to start with is the Salem Hospital robotics program has been operating for about 18 years. So the first patient received Da Vinci surgery back in 2007 by Dr. Cost. He did a prostate case. And so you'll notice that over the last 18 years, the robotics program here at Salem Hospital has continued to evolve and continue to improve.
Okay, so this is the Da Vinci 5 or the DV5 robotic surgical system that we use that provides, that allows us to do minimally invasive surgery, whether it's in the chest or the thoracic space or in the abdomen. Multiple specialties use this system. It's an additional tool for the surgeon to use. We control these wristed instruments from the surgeon console. This platform is set up at the patient's bedside. Each one of these ports goes through a small incision. These wristed instruments can be exchanged out. And with this, we can attach electricity to it. You can cut, you can sew, you can dissect, what we call dissection. But it really allows for fine, precise movements with these small wristed instruments in tight spaces.
It's controlled at all times by the surgeon?
Correct.
Is it real time even though these arms can move in different directions?
It is real time. You can see as he's moving his arms over there, those you can see that these instruments are being moved at the same time. The camera is a 10 times magnified 3D image with a camera in each eye. It allows for a 3D view through the console that gives you a lot of sharp, crisp, magnified images.
So you'll find these instruments can actually rotate 540 degrees and they can actually rotate 90 degrees in all directions. So it allows basically the surgeon to perform surgery in an environment, in a capacity that removes those limitations that they might have with their actual hands. This is where the surgeon will sit and they will actually utilize both of those hand controls to actually move the instruments that are positioned here. Yeah, please do. Next, what I want you to do is I want you to put your hands through the hand control. So with your thumb and your middle finger, I want you to place your hands into the rings just like so. Thumb and your middle finger of both. We'll go here. Perfect. Yep. Exactly. Yeah. And so what I'm going to have you do is I want you to open and close your fingers. Keep your head into the console there. Yep. Now notice you've got control of both of those instruments. So go ahead and flex your wrists, left and right, up and down. And notice how the instrument will respond exactly to what you're doing. Do you see that? I'm going to point out exactly what ring I want you to grab, and I want you to go over, pick it up, and then put it onto the next ring, okay? So what I want you to do with your right hand, I want you to grab onto that green ring for me, please, with your right hand. And you can roll your wrist to get a better angle. Perfect. All right, you're good to go now. So Da Vinci 5, it's the first robot we've released in 10 years. What you'll find, we've really invested heavily into the digital infrastructure, recognizing that there is opportunities for there to be objective insights that can be gathered from the actual surgery itself to help make surgeons, more efficient, more effective. One of the main drivers to robotic surgery is just the impact that it has for the patient, right? The robotic platform is allowing surgeons to perform that complex surgery in a minimally invasive fashion, potentially reducing their time in the hospital, as well as also reducing pain and any type of complications.
So this is our Ion robotic bronchoscopy system. This is a new system for us here at Salem Health. It's obviously been very enjoyable learning this new technology. It makes it very easy for the proceduralist, whether it's myself or an interventional pulmonologist, to get through the learning curve. This system allows us to biopsy smaller lesions that are identified out in the periphery of the lung and in all segments of the lung, right? So our goal is to identify earlier stage cancers in nodules that we are highly suspicious could be cancerous. We use the rollerball system on the console here to advance the catheter, looking at the live image, 2D image on the right, and then AI-generated tracheobronchial tree on the left. As we advance here, you can see that we follow our planned pathway out to the nodule, trying to stay in the center of the airway to avoid smudging of the scope. Yep. And as you can see here, just shows us the near and far points of the nodule and how close we are to the lining of the lung. So you want to go right here. So look to the left.
Okay.
And then down first. Down a little bit. Yep. And so then you're going to see there's 3 airways here, right? So you're going to want to go right this one to the right.
Oh yeah, because I'm following.
Yeah, follow the blue.
Okay.
And then a little bit farther in advance. Yeah, and you stop right there. You can see how close you are here. And the tumor should be right on the other side of that. If we're ready to biopsy, we take this out. So see, it takes the camera out,
Okay.
but it keeps the catheter in the correct position. And then what we do is we use an instrument, such as the biopsy needle here. We put it through the working channel. And then we just take samples, and then we can put it right on a slide, and the pathologist can look at it for us right away. Lung cancer is the second most common cancer in men and women, and is the highest cancer-related mortality. And so prognosis is related to the patient's stage of disease. Unfortunately, overall 5-year survival for lung cancer is still about 28%. A lot of patients are still presenting with late stage or metastatic disease. What we're trying to do is identify patients who have nodules that are suspicious for lung cancer. We'd like to diagnose those patients earlier so that they can have treatment that allows them to have a higher chance of having cure.
So what does the future hold for robotic-assisted surgery? Is it here to stay?
Since 2007, Salem Health Hospital has done over 6,000 cases amongst different providers and different specialties. And those numbers are only going to continue to ramp up, especially as it's becoming more and more common for surgeons to be using this minimally invasive approach to do more complex operations.
Thanks for joining us on InSight OnSite. I'm Wendy Brokaw.